أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب زدني علما رب زدني علما رب زدني علما رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Let's talk about the functional somatic syndrome. So this is the diagnosis for most of the medically unexplained symptoms. So you can say that functional somatic syndrome is kind of equal to the medically unexplained symptom. So what are the functional somatic syndromes? Those are the syndromes where the patient has symptom, but we cannot explain the symptoms with a specific underlying organic disorder. There is no specific pathology in the investigations or in the clinical history and examination. There is no specific pathology ultimately. You can't find a cause. You can't demonstrate a cause. Biopsy is normal. Imaging is normal. That is functional somatic syndrome. The patient has symptoms, but it cannot diagnose a specific medical condition. So you can't explain. There are many functional somatic symptoms in many systems. In GI, the classic functional somatic symptom will be the IBS and the functional dyspepsia. Functional dyspepsia because your endoscopies are normal, your imaging are normal. In this gynecology, the premenstrual syndrome is a classic functional somatic syndrome. Premenstrual syndrome. Another one is the chronic pelvic pain. In other systems, for example, in rheumatologic system, musculoskeletal system, fibromyalgia is a classic disease where the patient has severe fatigue, sleep disturbance, and he or she has pain. And the pain is in multiple sides of the body. There are multiple spots in the body, such as neck, chest, gluteal region, and legs. Multiple pain sites and tender points all over the body. That is fibromyalgia. In cardiology, the classic will be the atypical or non-cardiac chest pain. The patient has chest pain, but all the investigations, including ECG, echocardiogram, even angiogram, are normal. In respiratory diseases, there is something called a hyperventilation syndrome, where the patient hyperventilates and has got the perioral paresthesia, has got numbness, tingling, and maybe carpopedal spasm, all due to hyperventilation. But you can't find a cause. There is no pulmonary embolism, there is no pneumonia, or there is no pneumothorax. Chest X-ray are normal, bronchoscopy are normal. Everything is normal, but still the patient has this hyperventilation. Probably this is related to anxiety disorder. Probably this is related to a panic attack. Other conditions include the post-viral fatigue, such as fatigue after COVID-19. This is a post-viral fatigue syndrome. Oftentimes, this can persist for months. In neurology, the classic ones would be a non-epileptic attack, also known as the pseudo-seizure, non-epileptic attack or pseudo-seizure. Another one would be a tension type headache and a functional gait disorder. So those are the classic functional somatic symptom in nervous system. In ENT, you have something called a Globus syndrome, where the patient feels like she has something in her throat, and that is like obstructing her swallowing, that is impairing her swallowing. That's a Globus sensation. There is something in the throat. In dentistry, the classic example of functional somatic symptom or syndrome will be a TM joint dysfunction, temporal mandibular joint dysfunction. Another one would be atypical chest pain, atypical facial pain, atypical facial pain. So those are the functional somatic syndromes that a patient can have. If a patient has functional somatic syndrome involving multiple systems, and she does not or he does not have another diagnosis, then that will be called a somatoform disorder. Somatoform disorder. When a patient has functional symptoms, the functional symptoms in multiple systems, then we call it a somatoform disorder.